So the healthcare system has continued to change relatively significantly in Arkansas over the past several years. Most of those changes have been the result of the Affordable Care Act. Consumers now have new options for affordable health care and comprehensive health care, some for the very first time. But there also has been lots of ongoing debate about some of the changes we've made to our healthcare system, how to sustain those changes long term, how to make sure folks have access to care, but that as a state we can actually afford to provide that care. So the new governor, Governor Asa Hutchinson, in an effort to really come up with some real solutions for the state, created a legislative task force. And so legislation was passed during the 2015 session that actually laid out the charge of that task force, and since that time they have been meeting and will soon make recommendations. So we came up with a top 10 list of healthcare reform principles in order to simplify what is a very complex topic. The healthcare system is complex. And so as our legislators and policymakers discuss what are the important changes we want to make to our healthcare system, we see this as an opportunity to really highlight how we can improve care for children and families in Arkansas. So the principles in this top 10 list provide a guide for some of the key areas that are important to address in our healthcare system. So the number one principle on our list is ensuring that children in Arkansas have access to coverage. This is one of the areas in our state that we are the most proud of in terms of gains we made. In 1997, when we started the Our Kids First program, 1 in 4 children were uninsured, but we have significantly reduced that number. And so we want to make sure as changes occur to our healthcare system, none of those changes negatively impact children. There are some children, despite the gains we made, they're currently completely left out of coverage. And those are children who are legally present immigrants. And so we also would like to highlight the importance of taking advantage of the options that we have available to even extend coverage to those children as well.